What if I told you that the one thing you've been told to avoid for the past 40 years might actually protect your heart? Would you believe me? Every single minute, 3 people die from heart disease somewhere in the world, according to the World Health Organization. And the most heartbreaking part? Many of them did everything right. They gave up eggs. They switched to whole grains. They took their cholesterol medications faithfully. And yet, one day, they collapsed from a heart attack. Have you ever wondered, what's really going on here? Imagine this. There's a big house fire. When the police arrive, they see firefighters at the scene, doing their job. But instead of thanking them, they accuse the firefighters of starting the fire because they were present at the scene. Sounds ridiculous, right? But that's exactly what we've done to cholesterol and to eggs for decades. You were taught eggs are high in cholesterol, cholesterol clogs, arteries, eating eggs, higher risk of heart attack. But here's the truth no one told you. In 2015, the U.S. government quietly removed its dietary cholesterol warning. No press conference, no apology. They simply changed the guidelines. Meanwhile, an entire generation kept dieting, taking pills, and living in fear, desperately hoping to avoid the worst. In this video, I'm going to uncover everything they never told you. Why eggs were blamed. What science really says about cholesterol and heart disease. The latest research that could actually save your life, or the life of someone you love. And most importantly, how to eat eggs wisely to support your heart, not harm it. But first, let me ask you, do you have the courage to question everything you've ever been told? Because the truth is about to be revealed, and it just. There's a famous saying in the world of science, if you want to change the world, publish a study. But if that study is wrong, you could damage the health of millions. In 1955, a scientist named Ancel Keys did exactly that. During a presentation to the World Health Organization, he introduced a bold theory. Saturated fat and dietary cholesterol cause heart disease. To prove it, he launched the now famous 7 countries study. His conclusion? The countries that consumed more fat had higher rates of heart disease. And just like that, the idea that cholesterol equals danger became accepted science. But the truth is, the study was deeply flawed. Keys deliberately ignored data from countries that didn't support his theory, like France, where people ate butter, cheese, and eggs, and still had strong, healthy hearts. It was like redrawing a map just to prove the Earth is flat. Still, the U.S. government bought into it. In 1977, the U.S. Senate's Nutrition Committee released the first official dietary guidelines. Eat less fat. Avoid cholesterol in food. Increase intake of refined carbohydrates from grains. What happened next? Since the late 1970s, obesity, diabetes, metabolic syndrome, and heart disease have skyrocketed. According to the CDC, adult obesity rates in the U.S. rose from 13% in 1960 to nearly 42% by 2020. Meanwhile, the food industry flooded the market with low cholesterol and low-fat products, loaded with sugar, corn syrup, and refined vegetable oils. And the public? They gave up eggs. They ate morning cereals. They feared fat more than cigarettes. And yet, many still ended up in the emergency room with heart attacks. Reliable sources. In 2015, the U.S. Dietary Guidelines quietly removed the limit on dietary cholesterol. USDA. Cholesterol in food has little effect on the cholesterol in your blood. Harvard Medical School, 2020. The problem isn't just the egg. The problem is that your trust has been manipulated. And now, you and your family are paying the price. But you don't have to keep believing the lie. What matters most is that you're here now, and you can start over. So what can you do? Don't trust any advice without verifying it through the latest science. Share this video with your loved ones so they can hear the other side of the story. And stay with us, because in the next section, you'll discover cholesterol is not your enemy. Let's take a deep breath together, because what I'm about to tell you may go against everything you've been taught for most of your life. You've been told that cholesterol clogs your arteries like grease in a kitchen drain, that it slowly builds up until your heart can't take it anymore, that every bite of egg yolk, butter, or red meat pushes you closer to a heart attack. But what if I told you that's not how the human body works? You see, cholesterol isn't a villain. In fact, it's essential for life. Every single cell in your body, especially your brain and your heart, needs cholesterol. It helps your body make hormones, repair tissue, produce vitamin D, and even digest fats. Without cholesterol, you wouldn't be alive. So why did it get such a bad reputation? Because when doctors found cholesterol present inside arterial plaque, they assumed it must be the cause, just like blaming firefighters for being present at the scene of a fire. But science has evolved. We now know that cholesterol doesn't cause damage on its own. It's part of the body's repair system. The real issue is inflammation, oxidative stress, and insulin resistance, all of which irritate the arteries and cause tiny injuries in the vessel walls. And when there's damage, your body sends cholesterol to the scene, like a bandage. Cholesterol doesn't start the fire. It shows up to put it out. Let's hear from the experts. There is no strong evidence that lowering cholesterol in the diet reduces cardiovascular risk. British Medical Journal, 2016. High total cholesterol is not a good predictor of heart attacks. Many people who suffer heart attacks have normal or even low cholesterol levels. Cleveland Clinic. That's right. Many heart attack victims have perfect cholesterol numbers. Now think about that. How many people do you know, maybe even you, who've been told your total cholesterol is too high and that you must take statins for life? And yet, you still struggle with fatigue, memory problems, joint pain, or even blood sugar issues. That's not coincidence. Statin drugs lower cholesterol, yes, but they can also lower your body's natural defenses because they reduce CoQ10, a compound critical for energy and heart function. The tragedy? We've spent decades fighting the wrong enemy. We've been afraid of a molecule that our body actually depends on. So what now? First, reconsider the fear you've been taught to have around cholesterol. Second, ask your doctor about checking inflammation markers like CRP or triglyceride HDL ratio, not just LDL numbers. Third, in the next section, we'll reveal something even more shocking. Why eggs, yes, eggs, might actually protect your heart. Because healing doesn't always start with more medication. Sometimes it starts with. Now let's talk about the food that's been misunderstood, feared, even demonized for decades. The humble egg. For years, doctors warned us, don't eat too many eggs. They're loaded with cholesterol. Many of you probably switched to egg whites, ate dry toast, or gave up your Sunday morning omelets. And yet, despite all the caution, the heart attacks kept coming. It's time to set the record straight. Here's the truth. Eating eggs does not increase your risk of heart disease. In fact, eggs may offer protection for your heart if you eat them the right way. Let's break this down. Each whole egg contains about 186 milligrams of cholesterol, all of it in the yolk. That's true. But remember what we said earlier. Dietary cholesterol doesn't necessarily raise blood cholesterol for most people. In fact, only about 25% of people are hyper-responders, meaning their cholesterol rises modestly when they eat cholesterol-rich foods. But even in those people, studies show that the balance between LDL and HDL stays stable or improves. Scientific evidence says consumption of up to 1 egg per day is not associated with cardiovascular disease risk. Journal of the American College of Nutrition, 2018. Eggs contain many beneficial nutrients that outweigh their cholesterol content. Harvard T.H. Chan. School of Public Health. Eggs are one of the most nutrient-dense foods on the planet. They contain choline, which supports memory and brain health. They provide vitamin D, essential for immune and cardiovascular function. They're packed with selenium, B vitamins, lutein, and zeaxanthin, all antioxidants that fight inflammation and protect your arteries. And perhaps most importantly, eggs are a complete source of high-quality protein, which helps stabilize blood sugar, preserve muscle mass, and improve metabolic health, especially as we age. Compare that to a bowl of cereal and skim milk, loaded with sugar and processed grains that spike insulin, fuel inflammation, and actually damage your heart over time. It's almost ironic, isn't it? We were told to fear eggs and embrace heart-healthy cereals, when in reality, the eggs were never the problem. The true danger? Over-processed foods, refined carbohydrates, inflammatory seed oils, chronic stress, and sugar. Not the egg your grandmother used to crack open in her kitchen. So what should you do? Bring back the whole egg. Not just the white. The yolk is where the nutrients live. Choose pasture-raised or organic eggs when possible. They have higher omega-3s and lower inflammation markers. Cook them gently. Boil, poach, or scramble in olive oil or butter, not in toxic vegetable oils. And most of all, let go of the fear that's been planted in you for far too long. Healing your heart doesn't just mean removing what's bad. It also means bringing back what's good. And eggs are one of those sacred, misunderstood. So now you know the truth. Eggs are not the enemy. They're not the cause of your heart problems. In fact, they might just be one of the most powerful tools you can use to support your health as you age. But how you eat them matters. Just like any powerful medicine, eggs should be used wisely, with intention, with balance, and with respect for the body's changing needs after 60. First, let's talk about quality. Not all eggs are created equal. The best choice you can make is pasture-raised or organic eggs. These eggs come from hens that roam freely, eat natural diets, and produce yolks that are deeper in color, richer in nutrients, and higher in omega-3 fatty acids, the same healthy fats found in wild fish that reduce inflammation and support heart function. You'll also get more vitamin A, vitamin E, and antioxidants like lutein and zeaxanthin, which protect your eyes and reduce oxidative stress, all crucial for aging bodies. Second, consider how you cook your eggs. Avoid frying them in processed vegetable oils like canola or corn oil. These introduce harmful compounds that cancel out the benefits. Instead, cook your eggs in extra virgin olive oil, avocado oil, grass-fed butter, or simply boil or poach them. These gentle methods preserve the delicate structure of the egg and reduce exposure to oxidized fats. Portion matters too. For most healthy older adults, 1 to 2 eggs a day is perfectly safe and even beneficial. As always, it's best to work with your healthcare provider to personalize it based on your full health picture. Another tip? Pair your eggs with whole, unprocessed foods. Scrambled eggs with spinach, mushrooms, and tomatoes? That's a heart-smart breakfast. Boiled eggs with a side of avocado and berries? That's a blood sugar-friendly lunch. What you want to avoid is the classic American big breakfast. Eggs with white toast, bacon fried in seed oils, sugary orange juice, and pancakes on the side. That's not the egg's fault. That's a metabolic disaster disguised as tradition. Let's be clear. You don't have to fear the yolk. That's where most of the nutrients live. Separating the white from the yolk is like throwing away the best part of the symphony and listening to a single note. And if you've avoided eggs for years out of fear, it's okay. You did what you thought was right. But now, with new knowledge and new science, you have the power to reclaim a food that's been unfairly judged. This isn't about perfection. It's about making peace with your food, your body, and your heart. So here's your new morning routine. Choose high-quality eggs. Cook them gently in healthy fats. Eat them alongside colorful, whole foods. And enjoy them. Truly enjoy them, without guilt. Because every day you eat with purpose is one more step toward healing. And healing doesn't have an If you've lived through the last few decades, you've probably seen health advice about cholesterol flip-flop more times than you can count. One year, eggs are dangerous. The next, they're a superfood. One moment, cholesterol is the enemy. The next, it's not a concern. For many older adults, this constant back and forth has left behind a trail of confusion, frustration, and fear. But behind the ever-changing headlines, something more important has been happening. Real science has evolved. And quietly, without much media coverage, official dietary guidelines have changed. In 2015, the U.S. Dietary Guidelines Advisory Committee made a quiet but monumental change. They stated, cholesterol is not considered a nutrient of concern for overconsumption. This statement officially removed the long-standing limit of 300 milligrams of dietary cholesterol per day. In other words, eating cholesterol-rich foods like eggs was no longer discouraged. Yet how many people actually heard about this shift? How many doctors updated their advice? For many, the fear of eggs and cholesterol lived on, despite the science having moved on. By 2020, the American Heart Association also updated its approach, moving away from single-nutrient fears. Instead, it emphasized the importance of whole dietary patterns, focusing on eating more vegetables, fruits, healthy fats, and whole foods, while limiting added sugars and ultra-processed products. Notice what's missing? There's no warning about eggs, no demand to skip the yolks. Trusted institutions have also clarified the science. Harvard Medical School states, cholesterol in food has little effect on the cholesterol in your blood. And the Cleveland Clinic notes that total cholesterol is a poor predictor of cardiovascular risk without context. These statements confirm what emerging research has shown. Cholesterol levels are more complex than we've been led to believe, and what you eat may not have the simple, harmful effect on cholesterol that was once assumed. So why are millions of seniors still on low cholesterol diets, still avoiding nutrient-rich eggs, and still living with anxiety about every bite? Because systems change slowly. Many physicians were trained decades ago when the fear of cholesterol was at its peak, and unless they've actively updated their knowledge, their guidance may be based on outdated science. But here's the truth. You don't have to wait for your doctor or the media to catch up. You're here now. You're learning. You're asking questions. And that means you have a choice. If your doctor tells you your cholesterol is high, dig deeper. What kind of cholesterol? What about your triglyceride to HDL ratio? What's your C-reactive protein level, a marker of inflammation? Cholesterol without context is just a number, and you deserve more than a number. You deserve the whole picture. So instead of fearing one lab result, focus on your whole life: how you eat, how you sleep, how you move, how you manage stress. This is what truly influences heart health. Because in this new decade, the science is finally reflecting what common sense and traditional wisdom already knew. Eggs are not the enemy. Cholesterol is not the killer. And you, no matter your age, still have the power to protect and heal your heart. By now, you've heard a lot. You've walked with me through the myths, the science, the hidden truths, and the real causes of heart disease. You've learned that eggs aren't the villain, that cholesterol isn't the enemy, and that so much of what you were taught about food, about fat, about health, was built on shaky ground. But beyond the science, here's what I really want you to know. You were never broken. You were misled. And that pain, that betrayal, it's real. For years, you tried to do what you were told. You avoided eggs. You switched to margarine. You filled your pantry with low-fat products and processed cereals. And yet, your energy dropped. Your weight went up. Your labs got worse. You followed the rules and still ended up sick. That kind of betrayal runs deep. It doesn't just affect your body, it affects your trust in doctors, in medicine, in yourself. And I want to say this with compassion and truth. It wasn't your fault. But now, the truth is in your hands. Because once you know the truth, you're no longer just a patient. You're a partner in your own healing. The fork in your hand has more power than any prescription. The walk you take, the breath you slow, the egg you choose to enjoy. These are daily acts of reclaiming your health. You don't need to overhaul everything overnight. You just need to start. Small, steady, and sincere. One real meal, one deep breath, one new question for your doctor, one hopeful choice for your heart. So tomorrow, I invite you to do something simple but powerful. Crack open an egg, pasture-raised if you can. Look at its golden yolk, rich in nutrients you were once told to fear. Cook it gently, eat it slowly, and say to yourself, I am no longer afraid. Because that egg, it's more than food. It's a symbol of freedom, of healing, of truth reclaimed. And if this message touched something inside you, if it reminded you of your power, your worth, your hope, please, don't keep it to yourself. Someone you love might still be living in fear, still avoiding real food, still confused, still sick, still waiting for permission to heal. Be the one who shares the truth. Be the one who says, there's another way. Be the one who lights the path for someone else. Because knowledge heals. And together, we can bring that healing to every kitchen table. One egg. If you've made it this far, thank you. Not just for watching, but for staying open. Open to new ideas. Open to truth. Open to healing. That's not easy, especially when you've spent decades following advice that now turns out to be incomplete, even misleading. But the fact that you're still here, still curious, still willing to learn, speaks volumes about your strength. You see, this video wasn't really just about eggs. It was about something much bigger. It was about freedom, about reclaiming ownership over your health, about learning to listen again, not just to science, but to your own body, because your body has been speaking to you all along, in the fatigue you feel after a low-fat meal, in the lightness and nourishing breakfast, in the quiet ache when something doesn't feel right, even if the numbers say it should. This isn't just information. It's a call, a reminder that you're not broken, you're not too old, you're not powerless. In fact, you're exactly where you need to be to make a change right now. And if this video gave you something, clarity, comfort, courage, please share it. Someone you love may still be living in confusion, afraid of the very foods that could help them heal. Your story, your comment, your courage could be the spark that lights some